People in Germany are facing tighter restrictions as the country grapples with a high number of coronavirus infections. Leaders of the federal and regional governments are meeting in a few hours' time to consider a range of measures, many of which are expected to target unvaccinated people. The aim is to bring down infection rates and to relieve the pressure on hospitals. Leaders are also expected to discuss mandatory vaccinations.
The Chancellor's office is waiting for its next occupant, but already the incoming Chancellor has made his first U-turn. Olaf Scholz is getting behind mandatory vaccinations. Members of Parliament will be able to vote as they wish on compulsory vaccinations, which could come into force at the beginning of next year, in February or early March. People can get ready. Parliament is expected to decide promptly on mandatory vaccinations, but forcing millions of people to get jabbed would be a big problem for Scholz's future coalition partners, the Free Democrats.
This would be a serious bodily infringement. Hopefully, we will agree that you can't force people to be vaccinated.
The outgoing government wants to see more vaccinations, which could also be done at dentists and chemists. And Germany's health minister says vaccines for children could be ready earlier than expected. From the middle of December, we'll have a vaccine for 5 to 11-year-olds. That is good news for parents and children. Many of them can't wait to get the vaccine to protect themselves. The Vaccine Commission's recommendations are still pending. The federal and regional authorities could also tighten regulations, for example, bringing in the so-called 2G rule in shops.
It is important that we get this rule throughout Germany. In effect, we will have a lockdown for unvaccinated people. They won't be able to go shopping so easily.
Unvaccinated people could still buy food and medicines, but would face wide-ranging social restrictions. The debate on compulsory vaccination is likely to be heated.
We can speak now to our political correspondent, Benjamin Alvarez-Gruber. Good morning to you, Benjamin. The outgoing health minister, Jens Spahn, always said that COVID-19 vaccinations would not be mandatory. So why are Germany's lawmakers considering this move?
Good morning, Sumi. The outgoing health minister is not the only high-ranking politician member of the government who's changed his position when it comes to mandatory vaccination. Also, the incoming chancellor, Olaf Scholz, back in September said that it's not the time to talk about a vaccine mandate. And some state leaders who were even against a vaccine mandate for people working in certain professions, like, for example, hospitals and nursing homes, are now calling for this general vaccine mandate. What many politicians were hoping for is to have a higher vaccination rate that has not reached 70% of fully vaccinated people here in Germany. And that's why they're considering to see if something like that would work, as many people who have still chosen to stay unvaccinated will hope to try to get the jab once they had the possibility. And now in Germany, where there are the possibilities now for several weeks and months to get the jab, they're thinking about another way of trying to improve this number of vaccinations. So that's why they're now thinking about this new vaccination mandate that could come into force next year.
Beyond a mandate, what other measures are being considered?
What they're trying to do and what they will discuss today is to try to limit indoor activities, to close bars, to close clubs as well, to ask for this health pass showing that someone is either fully vaccinated or recovered from the virus, and also to limit and sometimes also to prohibit these indoor activities that are still taking place. That's everything is being done, and they're thinking about the hospitals that are trying to not get to the situation where they cannot accept any more patients. It is believed that more than 75%, so 3 out of 4 non-critical surgeries now need to be postponed in Germany. And that's, of course, something that they want to avoid and try to lower that number as well.
Over the weekend, we saw a prominent group of scientists here calling for an immediate nationwide lockdown to relieve pressure on hospitals. How likely is that to happen?
Earlier this week, the country's constitutional organization said that the lockdown that was in place last year was abiding to the constitution, this partial lockdown. It's important to see what type of lockdown we are talking about. If it's a full lockdown, if it's a partial lockdown, or if it's a lockdown in some states, like a patchwork of agreements. But what the president of the Association of Intensive Care Units said, that independently of what measures will be decided, there will be around 6,000 patients in this intensive care units by Christmas. So, of course, that's also a measure, and that's why health officials and people working in hospitals are calling for strict measures as soon as possible.
Our political correspondent Benjamin Alvarez-Gruber, good to talk to you. Now to some other developments in the pandemic. New data from South Africa suggests that the Omicron variant could evade some immunity provided by vaccines, but the shots are still likely to prevent severe disease. The U.S. has identified a case of Omicron for the first time, and South Korea has halted quarantine exemptions for fully vaccinated travelers as it deals with record case numbers.